secret. So what is facial slimming treatment? With anti-wrinkle injections, what we do is we're treating the bite muscle, the masseter muscle, and we're placing anti-wrinkle injections into that bite muscle to cause a slimming effect. Now in the diagram here, you can see this is a typical injection technique that I use, is injecting 5 injection points into the lower part of the muscle. And what the anti-wrinkle treatment does is it relaxes the muscle. So imagine every day you're using your bite muscle, it's building up your muscle. When the anti-wrinkle treatment is placed in the muscle, it's like not going to the gym for a few months and the muscle flattening and becoming smaller. If you take your index finger and place it on the back part of the jawline and do a clench, you can see and feel the bite muscle, the masseter muscle, contracting, and it pushes your finger forward. For most patients with a standard bite muscle, I use a 5 injection point technique. I find it scatters the product nicely across the muscle. Now, how many units do you need? So a unit is a measure of anti-wrinkle product. Most patients that I treat use 25 units into each bite muscle, so 25 on each side. If you have a stronger muscle, I might use 30 units each side. Men tend to use more units than women do, just because we have stronger bite muscles. So on the day of the procedure, what I do is I like to mark up the area with a pencil. So I feel the muscle with my fingers and mark out my safe zone. I then draw up my anti-wrinkle product and then ice the area just before injection. I like to inject the muscle when the patient is clenching because it means it projects the muscle outwards and you can feel exactly when you're injecting. It's one of the least painful areas on the face to treat. The bite muscle around here doesn't really have many pain fibers compared to, say, the lower crow's feet or the frown area. So I find it really tolerable and it's very quick. So the actual injections probably take about 30 seconds in total. I find that the treatment really starts working or is noticeable at about 3 weeks in, and it should last around 6 months for most patients if the right amount of units are used. I tend to retreat after the 6-month mark, and you'll know when it's ready to be treated again because when you feel the bite muscle with your index finger, you'll feel that it's got that contraction again. So when it's treated, I say to patients, after about 3 or 4 weeks, when you're clenching, the muscle will feel soft, like a kitchen sponge, or like the feeling of tofu when you're clenching, and that's when you know that we've used the right amount and the treatment is working. Potential side effects, there's always a very small chance of a pinprick bruise at one of the injection points, but this isn't likely. It'll be more difficult to grind chewy food, so eating steak, eating chewy food is more difficult because the muscle has been weakened. We have to be very careful, as I said earlier in the video, to avoid a muscle called rhizoreus, and that's the muscle that goes across from the corner of the mouth. It helps open the smile nice and broad. But effectively what we're doing is we're treating the bite muscle low down and fairly far back on the jawline to avoid going near the rhizoreus or the smile muscle. If it was to be affected, and I probably say it happens once every 4 or 5 years, it would be a temporary effect where the smile is affected, and it may last up to a few weeks. Some patients ask whether it's a permanent treatment. It's not a permanent treatment. After 6 months, when the treatment has worn off, the muscle strength starts to come back and the muscle builds up gradually over time. So it's not permanent, it does need retreating if you want to achieve that slimming effect again. What's the approximate cost of treating? If you click on the link here, you'll be able to see a link to the costs that I charge for treatment. So I hope that is a quick explanation of everything you need to know about facial slimming treatment. But if you have any more questions, please click on the link below and read my article and comment below, ask any questions you like, and I'll get back to you.